96.1 FM. Streaming live on WURDradio.com and the WURD Radio app.
Run that back.
I'm Tonya Pendleton, and we are back with Reality Check. Just wanted to remind you, it's 91 in the forecast. That's the high for today, so we want you to stay cool out there, folks. Make sure you drink and stay hydrated. Get yourself a fan, some AC, go to the pool, do all those things to stay cool. And if you were traveling via Amtrak today, well, you want to give them a call and see. They had a delay earlier today. Trains were not running in either direction between Trenton and I think it was Metro Park. We'll double check on that. But in any case, if you were heading north on Amtrak, you want to check and make sure that those trains are going to run on time. Now, we want to introduce some guests, very important ones to Reality Check today. Sue Weldon is the CEO and founder of Unite for Her, and she is here with Tiffany Reed, who is a participant at Unite for Her, and we want to welcome both of them to Reality Check today. Good afternoon, or I'm always rushing to the afternoon. It's still morning. Good morning, ladies.
Good morning.
How are you today?
We're doing great. Thank you.
Wonderful. Sue, let me ask you, as the CEO and founder of Unite for Her, what exactly is Unite for Her, and why were you moved to found the organization?
Oh, thank you. Yeah, so, Unite for Her was born out of my own experience. I just didn't realize that I was building this business plan back in 2004 when I was diagnosed. I was just trying to get well for my children, my family, and I just saw this gap in the medical and wellness community and that gap in whole patient care. So, like where treatments like acupuncture and yoga and massage therapy and nutrition services and movement all actually help you adhere to treatment, help you manage your side effects and symptoms without more drugs and prescriptions. It's where I found my control, Tonya, in a disease I had no control over. I gained my confidence back, and that's what we do, for her.
And Sue, we should say you were diagnosed with cancer?
With breast cancer, yes, in 2004, yeah. And Unite for Her, we bridge that gap between the medical and the wellness community by providing integrative therapies to those affected by breast and ovarian cancer to help them do better on treatment, to help them have a better quality of life, reduce the level of stress, and really contribute to their improved survival.
And so this is Unite for Her, that is an organization, as you said, that marries traditional medicine with wellness. And Tiffany, you were a participant in the Unite for Her organization. Can you tell us what your experience was?
My experience was amazing with Unite for Her. It was rough going through breast cancer. I was in the middle of grad school when I got the diagnosis. I still worked a full-time job. I have a family. And when I found out about Unite for Her, which I've always been a breast advocate, so I was surprised I didn't know about them prior to my diagnosis. But when I got that phone call and I got that big care package in the mail and all the integrative services that they offer between them and the medical community, it's a marriage made in heaven. I didn't even know there was a specific oncology massage. And I still get them to this day, even though I'm no longer in the wellness program, because it benefits me because I still have some side effects from the breast cancer.
Sure. All
the educational services that they offer, it just keeps you educated on what's going on in the breast cancer and ovarian cancer community and all the different researches and everything. And the 6 weeks of free vegetables, fresh from the garden, you can't beat that. There's a lot of people that can't afford those things. So to be able to offer all of that, and they understand who they serve, they give you confidence, they empower you. I've been empowered by them, and I've been doing so many things since I went through that wellness program, even as far as being on the advisory board for Independence for Health Equity. So I've just been a part of other organizations. Other organizations have helped me as well because I found out about them through Unite for Her because they have an amazing partnership with other organizations. And I trust them. They have high standards of service. and I trust them, and they really have helped me through my cancer journey.
Wow. Well, I'm happy to hear that you had someone that was assisting you through what is a devastating diagnosis for so many women. And Sue, particularly for black women, because although my understanding is that black women, they are diagnosed less, but breast cancer can be more fatal for black women. Why is there such a disparity there?
I know, right? Like, according to the American Cancer Society, black women have a 4% lower incident rate of breast cancer than white women, but yet a 40% higher cancer death rate. And, black women are also twice as likely to be diagnosed with triple-negative breast cancer than white women. This is a health crisis, right? And UNIFER recognizes that, those health disparities and health inequities, there's a variety of different factors. A lot of racism and unconscious bias and, trying to bridge those gaps and be a part of the solution. We have seen so many organizations lifting their heads up and leaning in and making sure that we can be hands-on on the ground, us included, doing better. And that Gilead grant, that Toward Health Equity grant, helped us do that.
Tiffany, as a breast cancer patient, why did you feel that having the assistance of Unite for Her was better than just working with the traditional medical establishment? Had you had previous interactions with the traditional medical establishment that you weren't happy with?
I can't say that I wasn't happy. I just would say bridging the both of them together, in my opinion, would help anybody, especially those that are underrepresented or not getting what they need, the health equity issues and everything. Unite for Her, the integrative services that they offer along with medical go together. That is what is going to help a person recover better. And I feel like not only have I recovered better from it, but I feel like I'm a better person, like from everything that they had to offer along with what I went through, through my breast cancer journey. But I know that there's a lot of people out there, a lot of women that look like me, that have triple negative breast cancer like myself. While I am doing better, I am not cancer free. So it's really important for me to let people know how important Unite for Her is and what they can do to bridge that gap. Because there are issues out there in the medical community. I talk to women all the time. I'm a patient pair for Aberson Cancer Center for Penn Medicine, so I'm educating other women as well. And when I talk to them and they partner me with a patient, I'm educating on, do you know about Unite for Her? What type of breast cancer do they have? Are they getting the services they need? And if they're not, I'm here to help them.
Right. So what do we know about triple-negative breast cancer and why it impacts black women so disproportionately?
Yeah, it's an aggressive breast cancer, one of the most aggressive forms, and it tends to grow and spread very fast. There's fewer treatments available, options available, and we also know that the impact of this cancer is not equally felt, right? Like black women are 30% more likely to die from these tumors because of lower rates of surgery and chemotherapy. Knowing that there is this gap with triple-negative breast cancer, we want to make sure that we can give them the best possible tools in order for them to adhere to treatment and to do better. And right now, we are that bridge, right? We are that. This is what's available for triple-negative breast cancer. As far as the medical community, we always say that, the doctors and the medical teams have a hard job to do. They have to treat that cancer. But at Unite for Her, we treat the whole patient, and we help them adhere to treatments and do better on treatments. And when we measure, we make sure that we have surveys measuring our outcomes to ensure that we're on the right path. But when we see that 86% of our members reported improvements in their side effects and 93% reported improved quality of life, 91% reported healthier food choices and increased exercise and movement, we know that we are giving them that emotional and physical tool to do better and adhere to treatment. And that is what can help move the needle so they can stay on that treatment because it's difficult.
Right. Tiffany or Sue, either one of you can answer this question. How do people how are they most commonly diagnosed with triple negative breast cancer? And is it a delay in diagnosis that makes this such a fatal cancer for Black women?
Yeah, go ahead, Tiffany.
I would say when I did my research in grad school, yes, there is a lot of delay. I was fortunate because I had been getting my mammograms for about 9 years prior to my diagnosis. So I started at the age of 39. I was 3 days before my 48th birthday when I was diagnosed. So I was somebody that had some education on the importance of getting mammograms, but I also was somebody that had insurance. So there's a lot of different factors, but most of it is through research that I saw it is a later diagnosis. I've encouraged some of my own coworkers who were afraid to get mammograms, who were in their 40s. I didn't pressure them. I just gave them some love, and they got their mammograms. So that right there is a big thing because they delayed getting it because they were afraid or they don't have the knowledge or the understanding. They may not have the insurance. So it's so many different factors that go into it. But yes, late stage diagnosis is one of them.
Right. And we should say that even without insurance, there are programs in this area, in the state, in the city, where you can get mammograms for free. It is one of the cancers that you can get a free screening for it. So if insurance is a barrier, then that is their program, Susan G. Komen Foundation and folks like that, and you can ask your doctor about that because we wouldn't want for people to go without screening because if that is part of the challenge there, then we want people to go and get those screenings. And, overcoming fear, now that's a different thing, but there is also a component to Unite for Her that is the Lift Her Up program. Can we talk about that?
Yeah, absolutely. So Lift Her Up, that was, born out of what we do. We provide integrated care. And for the Gilead grant, we had this opportunity to expand and elevate how many we could reach. Our target was Black women with triple negative breast cancer. 30% of them are living with metastatic disease. We knew that we could expand and have 550 women and men, because men do get breast cancer, treated with access to this grant. The fact that Gilead was able to set us up and invest in us in order to get that funding, like Tonya, our model is not cheap. It's $2,000 worth of services that we truly deliver, just like Tiffany says. And we make sure we pay those providers at the best gold standard of care. But we need funding for that. And this enabled to set us up, have beautiful collaborations with other nonprofit partners, other 340B hospitals that are in the area, across the nation as well, that we could link arms with and do it together, right? This was a collaborative approach. And we could provide now access to this type of integrative care that helps them stay on treatments, to helps them get a better emotional and physical well-being so they can tolerate the treatment, because of this access to the funding that we were able to get with this Toward Health Equity grant. It's been life-changing and impacting, so much so that, our community, they talk to us. Behind me, you'll see all of our love notes. They send us emails. They send us all kinds of text. And there's one that just sticks with me. It actually came from April, this past April, and Sana had talked to us about the impact of that Gilead grant. And she said, I am so grateful because I used to have to worry about food during treatment. It was a big stress for me. And when I was on unpaid medical leave from work for a year during my active treatment, I would starve just so that I would have money for transportation to my appointments and pay my medical bills. And being able to choose food without worrying about, your funding, right? Or your monthly income helped her tremendously. And no one deserves to feel that helpless. And they are the testimonials that we receive that we know we are measuring and on the right track, that what we are delivering is impactful and making change. And we couldn't do it without the support of a grant like this Toward Health Equity grant. We were focused. We were prioritizing. We knew we wanted to get to our Black community, our women with triple negative breast cancer, those with metastatic disease, early breast cancer. We had a targeted approach in underserved, undersupported areas. Those collaborations helped us get there, all, together in this.
And where can folks who are interested in participating in this program, is this something that your doctor has to recommend or your healthcare provider, or can people reach out to the organization on their own once they've been diagnosed with this cancer? How does that work?
Yeah, thank you, Tonya. All of the above. We do work with hospital partners to actually refer. We work with nonprofits to refer. That's how we get into these communities. Sometimes, like Tiffany was saying, people aren't talking about it. They're not, sharing. So we want to make sure we're collaborating with communities that are right in the culture we want to serve. But they can come to us directly, Tonya. They can go to uniteforher.org/apply. We make it incredibly easy. We have 2 wellness programs available. So, as far as funding is available, we can slot you into them. And that is the goodness that has occurred from a grant that we received from Gilead. So much so that, this year alone we'll serve over 5,300 newly diagnosed. But the work isn't done.
Right.
The work isn't done. We have so much more to do. And we rely on people linking arms with us, and having that same intent, right, of bridging those health equity gaps and having that same investment. It was beautiful to see the investment that was made in Unite for Her and 21 other nonprofits that received the health equity grant from Gilead.
Wonderful.
That was beautiful.
Sue Weldon, Tiffany Reed from Unite for Her, very important resource for the community. If you have been diagnosed with breast cancer and ovarian cancer as well, Sue, you can reach out to uniteforher.org/apply and find out about this wonderful marriage of traditional medicine and alternative therapies and alternative healing. Thank you so much for being here and sharing this on Reality Check today, ladies.
Of course.
You got it. Thank you.
And keep
Thank
up the good work. Take care. And we are Reality Check. We are heading